Good evening, everybody, to the last Unspeakable Bits webinar for the year. I'm delighted to say that our usual host, Trevis Gleason, is with us with a very special lineup. We've got the CEO of MS Ireland, Ava Battles. We've got from Brussels in Belgium, Elizabeth Kasilingam. I hope I got that kind of right. We've got Dr. Timothy Coetzee, who is the CEO of the National MS Society, and Elizabeth looks after the European Multiple Sclerosis Platform, EMPS. So just to let people know that down below there's a Q&A and there's also chat, but if you could just put your questions into the Q&A and I'll give them to Trevis and we'll go through those. So it'd be great if you could give us questions throughout the evening. So without further ado, I'll hand over now to Trevis.
Thank you, Fergal. And hello and welcome to everyone. This is, as Fergal said, the finest of the final Unspeakable Bits of 2024. I'm your host, Trevis Gleason, and we thank MS Ireland particularly for their support and for giving us this platform to delve into topics that were once, and I suppose still often are, considered taboo, but they're a real and important part of getting over, under, around, and through the challenges of living a life well with multiple sclerosis. Those of you who have been with us now for a while, and we've been doing this for over a year, you know that we don't shy away from the difficult topics, from questions about MS and sex and relationship difficulties and finances and so much more. And tonight we're not stopping. We're very honored to have an illustrious panel with us for you and our discussion tonight. We invite you to submit questions. As Fergal said, please use the questions tab, not the chat tab. And we'll get to as many of them as we can tonight. We also have a list of things that were emailed into us earlier in the week when people registered, so we'll get to those as well. Joining me, as Fergal said, from Dublin, Ireland, is the president of MS Ireland, Ava Battles. Ava, thank you very much for being here. From Brussels, Belgium, Elizabeth Kasilingam, who's the CEO and president of the European MS Platform, and that's EMSP, not ESMP, because I do the same thing. Fergal, we'll forgive you on that one. And on the eve of the American Thanksgiving, Dr. Tim Coetzee, PhD, who's the president and CEO of the National MS Society. I welcome all of you, first off, and on behalf of the entirety of the MS community, I want to thank you for the work that you and your staff, your organizations, the volunteers do for all of us. Your advocacy work that you undertake on our behalf is of invaluable importance to us. And though we're here to talk about the challenges and the difficulties that you foresee for the MS community, from each of you, from your unique perspectives atop your respective organizations, I'd like to start with something I learned in Management 101, I think it was. We called it the sandwich theory. So I think we'd like to talk about some of the successes, perhaps, some of the good things that have happened in the year previous. I know it's probably a little early for that end of the year top 20 list kind of thing, but maybe we'll start close to home here in Ireland. And I'll ask Ava if you could give us a brief, first off, I suppose for all of you, I'll ask this, maybe a little bit of a summary about the MS community in your area, and then what you might consider as one of the positives that you see in MS Ireland for 2024 behind us.
Thank you, Travis. So I suppose if I start with a brief summary, for me, if you look at neurological conditions in general, so in Ireland, 1 in 6 people have a neurological condition, and obviously this includes your Parkinson's, Alzheimer's, of course, MS, and stroke, and various other conditions. But then if we break that down and we look at, there are about 9,000 people living with MS in Ireland. But actually, if you look at the long-term illness scheme, there are 10,284 people actually accessing medication on the long-term illness scheme. And why I use those two figures is to show you that we don't have an MS registry in Ireland. And as a result of that, we don't even have the correct figures to talk about, how many people that we are working to serve. But I suppose if you break it down again, there's approximately 300 people diagnosed with MS every year. And I suppose another stat that I think is quite useful for our conversation is that one of the pieces of research that we've done showed that 43% of people living with MS are unemployed, and 47% of those have withdrawn from the workforce due to their MS. So again, that just gives you kind of a snapshot of MS in Ireland. And then on a positive note, I picked two things actually, Trevis. So one was following a lot of advocacy work by the Neurological Alliance of Ireland and MS Ireland and people with MS. So there was always a person with MS speaking at all of the events. The government have announced plans for an additional 2 million in funding for the expansion of neurology services in 2025. Now, that is quite significant in the scheme, but it is quite significant. That's a total of 25 additional home time equivalents. But the main thing here is 5 consultant neurologists. And we all know how rare the neurologist is in Ireland. And it's so for the likes of University Hospital in Kerry, the Midlands Regional Hospital in Portlaoise, Wexford General Hospital, Mayo University Hospital, and Letterkenny University Hospital. So these are 5 regional hospitals where there was absolutely none, so no access or very little access to neurology services at all. So this is going to be hopefully a game changer, because we all know about the level of travel that people have to make to their neurologist, how that impacts them. And we also know actually that's really stopping people from actually going to their appointments at all. So I do think that that piece for 2025 will be very significant. Unfortunately, we know absolutely nothing other than that, but that is really significant. And the second positive piece, I suppose, was, again, on another advocacy note, was a piece that we did for the MS Care Centre business case. So the Care Centre is a 12-bed respite facility that's based here in Dublin, and it has people coming from all over the country for respite, because what we saw during COVID was a lot of the smaller respite facilities actually closed around the country. So we received an additional, as in MS Ireland received an additional 250,000 to open the care centre full-time for the last few months of this year. So up until now, we've been closing every second weekend, the 4 days after bank holidays, and we have a beautiful care centre that could be open 360 days of the year. So we have confirmation as well that in 2025, all going well, we will receive funds to keep the care centre open for 360 days. So for us, that's just, I suppose, that's around the services that hopefully will be able to be provided to people with MS in 2025. So that's my start with the positives.
No, that's definitely positive. Of course, we might be funding neurologists, but where are we going to get those extra neurologists when it comes down to it, right?
That is a very good question.
Yeah. I remember when I moved here, my neurologist said, Trevis, there's 2 things in the world that I don't put together, and they're the words Ireland and neurology. But we've got better, that's for certain. We'll move on to the European perspective now. Elizabeth, I suppose first, what is the EMSP? Who do you represent, and what would be something that you would call for your cohort and as an MS organization and for people living with MS? What would be a positive for 2025 or for 2024? I'm sorry.
Hi, good evening, everyone. So I'm Elizabeth Kasilingam, CEO of the EMSP, which is the European umbrella organization of the national MS societies across Europe. And our role is really to represent the voice of the people with MS, their challenges, the needs in the European policy forum, so that we can influence positively the decision-making to improve the quality of life of the people with MS across the region Europe. We work with 38 countries across Europe, and that means that we represent also the neighboring country, not just the European Union. Having said that, in terms of the positive for the community this year, what we have noticed, or at least there are 3 points that I would like really to highlight, is first of all, after a very difficult period with the COVID, the socioeconomic crisis, we really see a change, a return to active advocacy and awareness raising from our member organization. And a more lively community than it was in the last year. So it's really nice to see. We also managed to mobilize some of the policy decision makers, because 2024 was an important year, the EU election year. So we mobilized the MEPs, candidates, and newly elected within our campaign to really fight alongside our community for better decision making in the future for people with MS. So we expect from the new mandate really some positive changes, but also the support from the policy decision maker, both at European and national level. We also have seen a lot of more investment in research in the last years for MS, and that has been a really positive, not only in terms of the financing, but also in involving better the patients in the development of the treatments, the therapies, the digital tools, and so on for people with MS. So that is also bringing a new perspective on how people with MS can actively contribute and participate in those developments. So those are the positives I really would like to highlight, because this is building our future.
And just to confirm for those who mightn't be completely understanding the concept, so EMSP is a representative organization under which many MS societies around Europe are. So what is your, I suppose, direct contact with people living with this disease, or are you more focused in on being a lobbying and representative group for the societies at the European Parliament and Commission level?
We do a bit of both. So we represent the National MS Society to be able to do our advocacy work, but we also work directly with the people with MS in some of our community work, like the Young People's Network, for example, where we work directly with the young people affected and providing support for them and specific activities addressing their needs and their concerns. So it's a bit of both that we do. We also work with patient experts to develop their skills and to build their capacity to be able to be better involved in the different initiatives for people with MS.
Okay, very good. Thank you very much. And then also now from the US, but also maybe with a bit of an eye to the global picture. Tim, first, might I congratulate you, your new role in the society. You were formerly the Chief Advocacy and Science Officer, and I think just the Science Officer when we met yonks ago. So maybe a little bit about the National MS Society, and also its place in the International MS Federation, because I know that that's sort of an international umbrella group as well. And then what would be a bright spot from the previous year?
Certainly, it's great to be with you, Travis, and your audience, and we go back to 2008, so more than a minute. I was younger then, thinner and younger then. So it's great to be with you. So honored to join Ava and Elizabeth and you in this conversation. So the National MS Society in the U.S., was founded by our founder Sylvia Lowry in 1946. So we've been around a while. Her brother had been diagnosed with MS in 1945, pretty much told there was nothing to be done for him. And she actually put an advertisement in the New York Times and asked if anybody had recovered from MS to write to her, and 50 people wrote to her. And that formed a community of people that then just 2 years later funded two projects, one in the US, one actually in the UK, and the rest is history. And so we have funded research for many years, funded patient programs. We support, there are nearly 1 million people living with MS in the United States. So, our remit as an organization has been historically to fund research, to support our mission, which is we will cure MS while empowering people affected by MS to live their best lives. And so part of what we do is we raise funds to support science, but also to drive the other half of our mission, as I call it, which is about ensuring that people can live more powerfully today than they did 10 or 15 years ago, which I will say is they do. They're able to because of all of our collective work. And so we have staff throughout the country that are focused on all of these efforts. So we, really the funds are directed towards driving a global research agenda, at providing a comprehensive services for people affected by the disease. And then the other aspect, which I think we can understate, which I know you have been part of, which we all are doing, is advocating on behalf of people affected by MS with our policymakers, whether they are in the federal government in the US or within the US state level organizations also have an incredible impact on the lives of people. And so we work also within the 50 states to try to make life better for people living with the disease. I'd say if you were to ask me what are some of the highlights from the year for us, certainly I think publishing the second iteration or the second edition of the Pathways to Cures roadmap is something that we're very proud of. that was published in the Multiple Sclerosis Journal just earlier this year. And it built on our Pathways to Cures roadmap that we had published 2 years earlier. So that's a significant, I think, significant outcome for us. To Ava's point, one of the other aspects we've been also grappling with is how many neurologists are there in the United States, and where are they in relationship to where people are? We have a big country, and 1 million people scattered throughout it, and we don't have enough neurologists. And so we teamed up with Deloitte, the consulting firm, to actually map out and develop maps that demonstrate where we have what we call neurological deserts, which is basically there are stretches, large stretches of the country where there are no neurologists within hours of where people with MS live. And so that has been incredibly helpful because it lets us then begin to understand what do we need to do to ensure that we can get people the care they need. And it's challenging because obviously putting a neurologist in a rural area, often it's not good. It's not actually enough. The doctor needs to have access to an MRI. They need to have a supportive health system.
Yes.
If they're going to prescribe infusion therapies, they need an infusion center that is ready to deliver all of that. And so when you're talking systemic change like that, it's really important for us to think holistically. So that's one other highlight. And then a third highlight I would put is that, in the States last year, there was the passage of a very large piece of legislation called the Inflation Reduction Act, which had a lot of, as most things happen with state legislatures, it had a lot of different things that legislation tried to do, but tucked into it was an important provision for individuals who are on our retirement health system called Medicare. So people over the age of 65 get access to the health system. And one of the aspects of life with MS when you're on the Medicare health system is that you don't have access to the patient assistance programs that people have access to while they're on, private insurance and the like. So people had to pay out of pocket, as we call it, many, many thousands of dollars just for their MS drugs. And oftentimes when you're over the age of 65, you got other things going on in your life that you need to pay out of pocket for as well. This year, as a result of those provisions, that is capped at $2,000 for everything, which is just an enormous, enormous win for people living with MS over the age of 65 in the States, which is a real positive outcome for us.
All right. Well, that's very good. And for people who are not familiar with the healthcare system, et cetera, in America, other than the horrifying nightmares that you hear, imagine in Ireland here, if every county council had their fingers in determining how people that lived within that county or within the province got their healthcare and how it was paid for, et cetera. To call it a labyrinth would be an understatement. That's for certain.
I'm not going to elaborate more on what I think about it.
We know where we're going there. I want to remind everybody in the audience that we can certainly take your questions. And we talked about the biggest challenges. Let's go with one of the biggest difficulties that we've had in the last year, and we'll just keep it brief, I suppose, because we've got a lot to get to. But we'll go in the same order. For MS Ireland, Ava, what was the biggest difficulty in the last 12 months?
Okay, so from an organization perspective,
yeah, or people living with MS in Ireland, sure.
Okay, so I think from an organization perspective, it would definitely be around the challenges facing what we call Section 39 voluntary providers. So just for everybody else, a Section 39 organization is an organization funded by our health service executive under Section 39 of the Health Act. And that's basically voluntary organizations that look after social inclusion, supporting people with disabilities, older people, and people with chronic illnesses. And really what the crux of all this is there's ongoing funding shortfalls from the state. So for example, if you take MS Ireland, we get about 60% of our funding from the state, and then 40% is fundraised. Okay, so obviously we face that challenge every year. But the wider sector has come together on this challenge around the funding shortfalls. So then there's the idea of multi-annual funding needed for the community and voluntary sector. So that message is trying to be out there now at the moment. Then the whole area of staff recruitment and retention difficulties is huge, because we just can't compete with the likes of the statute, they hate the health service executive in relation to pay terms and conditions and all that kind of stuff. That's really becoming a difficulty. And obviously the ones that's probably an issue for all of us is the increased cost of delivering services. So this obviously then makes it a real threat for the continuation of all these services. So that's why the voluntary sector has come together to I suppose to advocate on behalf of the voluntary sector as a whole, because we do actually provide a huge amount of services pretty much for the state, really. You know, there are services like, for example, if you take physiotherapy and things like that, that MS Ireland have started to provide, ultimately because the state weren't providing them. So I suppose that's been the organizational perspective, Trevis. And then I suppose if you were to go back to something we referenced earlier on, from a person with MS perspective, I'll do one and we can come back to others, but it is around addressing the lengthy waiting times for neurologist appointments, the regional inequity and lack of service in certain parts of the country. Like, we know, for example, that the waiting list for consultant neurologists appointment now stands at 21,000. We know from our own MS Ireland research that 10% of respondents to that research took more than 12 months to get their last appointment. So, like, we know that from the respondents to the research that people spend 2 to 3 hours driving to their appointments, all this kind of stuff. And it was nearly 10% waited more than a year for an MRI. So for me, if you lump all that together in relation to neurology services, I suppose that would be a really, really significant issue. And what we're looking for in relation to that is implementation of the National Neuro Rehabilitation Strategy, then, as a key commitment from government. But look, I suppose that's part of what I said earlier on about the recruitment of neurologists and specialists, hopefully in 2025. But they're the two things that I would highlight.
And they're major.
Yeah.
From Europe, Elizabeth, what in the last 12 months has been a thorn in your side?
From the organization and community perspective at European level, our focus was really on the political changes that we are facing at the moment across Europe, not only at European level, but also at national level. So the fact that we have seen the drop or the pushback on the health agenda has been very concerning, because we've seen that in an already difficult situation for the people living with MS, we see that the health priorities are being deprioritized, does not help for us to give hope also for the patients with MS in terms of better access to treatment and therapies, better access to the multidisciplinary care that they need for support for mental health. All these aspects now, with these new political changes, it's a little bit of a setback for the patients community across Europe. So that also comes, as Eva was saying, with a drop in financing of the patients' organizations. So the services that they're offering, we've seen that through our member organizations. They are facing financial struggle in the last years, and it's just increasing. So we really need to work together to push back this agenda, and that is a concern, because in time of crisis, advocacy and volunteering work is not something that people are mobilizing necessarily. So it's really also the economic pressures that come on this for the individuals living with MS at national level. They're struggling with housing, increased poverty. So all this comes with the general lack of support on the health and social agendas. So that is something that we have at really to work on in the future, and to make sure that we can fight together.
Okay, and I definitely want to go into the politics in a moment, because there's a lot to be talked about. I'm sure. Tim, what's the low point in the last year?
Yeah, I think similar. Economic uncertainty brings with it, just what does it mean for the future? It affects organizations like ours when people feel economically uncertain, that, since we rely on charity for our organizations. So if people are feeling uncertain, then they're giving less. And so that is certainly a low point. I'd say also the just political uncertainties associated with some of the change in our country, as change in election administrations, just introduces, what will happen with individuals' healthcare and those kinds of pieces. And so that adds a layer of complexity that, causes angst for people. And I'll say, the other piece more broadly is just, the challenge that if you were to ask me, what's the one thing that really frustrates you, is that I find that in 2024, I still hear too many stories of people taking very long to be diagnosed with the disease and being put through what I'll just describe as a diagnostic odyssey to get to their diagnosis. And particularly, I find that, in a disease that affects women disproportionately relative to men, some of what women have to endure from their clinicians as they're trying to have their symptoms be taken seriously is just nothing short of exasperating.
And this is the 2020s. It's not like
it
this
is. Yes, there are in 2024 the stories I hear that should be of the diagnostic era in the 60s just are very exasperating.
Frustrating.
Yeah, it is difficult. I mean, many of us who are on this program have been living with the disease for a long time, and we're looking for another tool to put in the toolkit to live better. And one of those is talking about the things that people don't talk about. So I certainly appreciate you being here, and talking about this. But for newly diagnosed or yet to be diagnosed people, and I know it's at the ECTRIMS meeting, there's a new criteria so that people could be diagnosed much faster, but if they're still going through stuff with their general practitioners and their family clinicians and stuff, that doesn't really matter what the standard is.
Exactly. Looks like Ava has a thought on that.
Yeah, because I would agree with you wholeheartedly there. That it frustrates me so much, but it's not. It's the diagnosis is one part, and then it's all of every part of the journey. Like, for example, just the simplest thing in the world. You talked about living well there, Trevis, and it just came to my mind where this gentleman the other day, one of our community workers, he's based here in Dublin, and he wanted an adaptation to his bathroom, right? Okay, so you can just live in your own home and whatever. He was told he had to wait 4 years on the waiting list to get the occupational therapist for that appointment. Because he absolutely on no way was a priority from the point of view of the service. And that just blows my mind. And that's at the simplest level. You know what I mean? A diagnosis is obviously hugely important, but it's every step of the journey. Access to housing, access to, employment, every piece there are still hurdles. And it just frustrates me so much as you said, in 2024 that we're still there. Well,
and if you didn't care, you wouldn't care. So thank you all for being here and giving a damn about those of us who live with MS. Let's go into the politics. And we'll begin with the fact that there were European parliamentary elections earlier this year, late spring, early summer. They've got the American congressional and political elections were earlier this month. We're in the final days, thank God. We don't have it as bad. Ours was a 3-week election from the time campaign from the time the election was called, but still it's different here. And so that will be on Friday here. So elections and the political change is a big thing going on. So we'll start with Elizabeth. You've got a newly elected European Parliament. They've begun their business. And so has the makeup of the newly seated Parliament, has that changed so far, what you're seeing at EMSP, and what's the biggest push from them this year that you think? Oh, sorry, you're muted.
Sorry for that. So I was just saying there are several things. One is before the Parliament, there was a shift in the EU priorities orientation based on the European Council's decision to really focus on peace and prosperity, and really drop down a little bit on a stronger EU health agenda. And that was the very beginning of, let's say, the setback. And that continued obviously with the elections that we had, or the results of the elections that we have, showing a very more conservative members on the Parliament, that will change also the priority areas, that will change all the little wins that we had over the years. It's really going back and having to refight for the things that we thought we we were granted. So I think that we will have to rethink a little bit and also make sure that we keep our motivation to fight for timely and equitable care, and to make sure that the financing of the national governments are put in that direction, but also in the EU level, that the directives that are created are also going into that, supporting better approach at national level. So there is a little setback that we will keep an eye and pushing for. So equal access to treatment and rehabilitation, that's something that we'll keep on our agenda moving forward. But more than that, social inclusion and protection. So again, we don't see the agenda on disabilities also is weaker now. So we will step alongside the European Disability Forum to be able to push back on this and bring back those notion and raise awareness about this among the European Parliament. And most importantly, also in terms of the economic empowerment of the people with MS, to make sure that the EU program can support that. I think that there is space for the EU programs to be supporting better approach at national level. So for that, we will also work with the European Parliament, but we are in the phase where we are identifying our allies at the moment, and we are working with different broader coalitions also, like the European Federation of Neurological Association, the European Brain Council. And so I think the more we will be in this advocacy field, voicing our needs together, the stronger we will get. So that's something that we really need to push for, to get a comprehensive EU strategy to have better policy improvement and a closer health and social policy agenda. That's something that is very important. And then on the financial side, there is more investment done, and that's an opportunity for us for research and brain health. So here, I think there is a lot that can be done if we get the right financing, and that's one of the support we can get from our MEPs to really have a vote for a budget that will help us improve the quality of life of the people with MS. So I think with the member organization, with our advocacy work at European level, if we mobilize ourselves and work together to push our messages, we should be able to get across despite the political origins of the MEPs. I think that's something that we need to differentiate.
And just for everyone who may not be from Europe and know, how long is a term of a member of the European Parliament and MEP?
So this mandate is from 2024 to 2029.
All right, so 5 years. Okay. Tim, we Irish aren't quite as used to the blood sport that American politics has become, but we certainly paid attention to the results. Between the House, the Senate, the White House, all the cabinet appointments that will come with a change of administrations, I know a good few people in America with MS have some real concerns about the future. So what is your view on the next 12 months in relationship to MS and the new government?
Yeah, a good question. Yeah, blood sport's a good way to describe it at times. Expensive blood sport too.
Yeah.
So I think, it's still early. So I just want to emphasize there's these the transition periods of one president to another, typically there's a lot of activity, and part of what we're watching is, there's a lot of words that are said, but then there's the actual policy and what they change and what they actually do. We are also now clearer. We know who controls the White House. We're getting clearer on who controls the Congress, and so those the margins of who controls the Congress are actually quite narrow. So that actually also introduces some work, some challenges, because the president can't just pass down mandates without them actually being passed through Congress for many things. So part of the work we are doing is rallying with other nonprofits to understand what are the areas that are going to be a focus. So healthcare obviously is one big focus. What will happen with healthcare? Another major focus will be what happens with medical research. So investment in the National Institutes of Health in those areas. I think the part of what we're seeing, some of the elements of healthcare, the healthcare agenda probably will continue to be the same, because as much as there's conversation around changing the health system within the United States, Obamacare as it's called, that's been around for a while, and so that's really quite embedded within our healthcare system. And so, unwinding that and introducing something new is quite requires quite substantial legislation. And no matter who's in the White House, one doesn't just say this is going to be the new insurance law. So that notwithstanding what you might be reading on the news about the power of the presidency, the actual allocation of money towards the operating of the government actually flows through the Congress. And when the Congress is so evenly divided, it puts in some brakes and controls around what can and can't be done. Part of what we do, is we have a set of principles that we use to guide how we think about healthcare and access to care, and whether or not someone could be excluded from insurance because they have MS. We call them pre-existing conditions, as they call them in the States. And so the work we're doing is just to watch very carefully what are the policy positions that the administration is taking, and then prioritizing which ones we would go to fight for as the MS Society on our own, but also what would we do in coalition with other groups? Because one of the things we have found is that if you're trying to do something on your own in the current environment, that's really, really challenging. But if you're in coalition with the cancer groups, the heart associations, and all these others, I'm sure very similar to what you do, what we see in Europe, you're able to be much more effective. I don't want to leave an impression that somehow we think all is going to be good. There's a lot we don't know. There are uncertainties, and there are, economic viewpoints that some have about who should and shouldn't have health care that we're watching very closely. But we're also taking a very measured approach, because, this is a 4-year run. And so part of what we're looking towards is what we would call playing the long game within the States, of just trying to see, not come out too quickly, because if one does, one may find that 6 months from now you're having to do something else. So
Are we back to Donald Rumsfeld's? We have known unknowns and known unknowns, and then unknown unknowns.
There are always those things, yes. There are always those things, and the important thing that I've been stressing with our leadership has been stressing with others is we are in an era where there's a lot more words that are said about things, in part to get attention on social media and a lot of other places, but that the key you have to do is there's not just reacting to the words, but actually seeing what the policies that are being put forward, and that oftentimes it's 90% words, 10% policy, and what we're focusing on is on the policy piece, and not letting the words distract us.
And I know that we have a link, and I'll ask Fergal to put that up. You had some particular wins with advocacy, et cetera, recently.
Yes, so I mean, we've had some really nice wins. One of which was we advocate every year for a special funding for MS research through the U.S. Department of Defense, and we've had that for a number of years now because veterans. After the first Gulf War, there was a spate of veterans that developed MS, so this created interest within the military establishment to fund medical research in this area. And so each year we've now been able to secure $20 million US for that. And that's really driven by the work of our activists year over year. So that's another big win. Another important win for us was we all travel on planes, and we know how difficult it can be for individuals who are traveling on a plane with disabilities, to not have their, power wheelchairs damaged and, suffer some of the indignities on air carriers. And so as part of the reauthorization of the US FAA, the organization that regulates airplanes in the United States, we started to put in some regulations and some work around, addressing accessibility issues on planes. And for example, I was recently on a carrier, a European carrier, and I had never been on a plane in a long time that had stairs, and the bathrooms were down a set of stairs on this plane. And I thought, well, how is someone supposed to access that? And that's the kind of thing that we want to do. Now we also appreciate, changing the infrastructure and how planes are designed is not a quick fix, but you have to start somewhere. And just trying to get principles of just general dignity for individuals and that people shouldn't have to worry about their devices being damaged or destroyed when they have to transfer from one plane to another. And so that was a big win for us.
Great. So we'll have Fergal put that up, and it's a webcast coming up on that. Ava, I've been using MS Ireland's asks as starting points for conversations when Dáil Éireann candidates canvassing to my door. For those of you in America, that's how it works here. There's no advertisements, there's no radio, television, no robocalls. It's posters and people coming to your door to talk. And those are good starting points for conversations. Without getting out your crystal ball that I know you keep in your desk, how does MS Ireland foresee life for people with MS changing as a result of what the new government might be?
Yeah. I'll tell you what, I'm struggling with this because I want to be positive, but part of me is frustrated because, as you can imagine, we have spent quite an amount of time now making and developing relationships with the current minister, the relevant ministers, the relevant people in the departments. We've had many conversations, we've had many business cases that we've submitted, and we've spent a huge amount of time advocating. And then you have a kind of a focus at the moment on that neurorehabilitation and a focus on respite. And that's all because that particular Minister of Disability has an interest in that area. And then I'm looking at where I'm at now, and we're in the final stages, as you mentioned, of a general election campaign, and everything changes. So the rug gets pulled out from underneath you and you start back again. Because people bring with them their own backgrounds, their own interests, their own thoughts. They shelve what somebody else has done. They want to change it. And that's the bit that is incredibly frustrating from, I suppose, from our point of view. So with that in mind, obviously, Trevis, you've mentioned the Your Vote Matters document that we have circulated to everybody in our MS community, saying, look, when politicians come to your door, you need to ask them these questions about the cost of disability, about healthcare and neurorehabilitation, about employment and transport, all the issues that people with MS said to us were important to them. But it's interesting what you said about social media and 10%, 90%, Tim, because in the last few days, our Taoiseach, which is our head of government, walks around and goes around house to house, door to door in the shopping centres, shakes hands, has conversations. And he had an interaction with a care worker, which is being described as the defining moment of the election campaign, where she talked to him about Section 39 organisations. So the organisations that serve people with neurological conditions and people with other conditions. And she was also a carer, and she got very upset and whichever. So I suppose the election is now, I suppose the media attention because of the election is bringing these important issues to the fore, which is great, which is actually really positive because we get to have conversations about them. And also our wider community is working together. And it goes back to another point you've made about how strong we can be if we work together and ask our candidates to be committed, I suppose, to disability equality and inclusion in the future work that they're doing, because I think that's important as well. I think we need to have the joint working and collective asks to our politicians. But I'm afraid we can't make any definitive predictions, as you would know. I'm going to say we remain, can I say, cautiously optimistic that the next government will obviously take the meaningful steps that we want them to take and address the challenges that we have identified and will continue to advocate for. But I mean, the party manifestos, for example, we could talk about them and say, I could take the Fine Gael one here now and say, isn't it fabulous? They've said everything about the neurorehabilitation strategy. They've talked about the recruitment of the various different staff. But I mean, that's great. And then I look at the unpredictability of actually politics in general. And then I kind of think, I have no idea, to be perfectly honest, how this is all going to play out. And that sounds terrible. But I think what we do is we try as much as possible to engage with them in the process. Now we have 150 of our politicians, of the candidates, pledging their support on our electoral portal. So that's positive. We'll continue to have those dialogues, continue to represent people with MS at every opportunity. And then we just have to watch this space.
Yeah. And I suppose, I mean, no poll matters until the
No.
polling day, but
Yeah.
it certainly feels like independent TDs might have a little bit bigger say. And that's difficult because they don't necessarily have a manifesto when it comes to things because they're independent.
Absolutely. And therein lies your challenge.
Yeah.
Mm.
Enough about politics. Well, sort of. We've got a question came in, and we've got a lot of how important and how much are things going to change. But um, Tim, maybe because you got the biggest fundraising and probably the largest organization for one country, certainly. The talk about neutrality in an election space because you need to raise funds from both sides, no matter who wins, et cetera.
Yeah.
And you can't be seen too much, even though, some of the things that you're asking for might look left-leaning to some, et cetera. How do you?
So actually, it's actually pretty easy in the States around that because to be a registered charity, a 501(c)(3) organization, as we are known, you are required legally to be nonpartisan, a nonpartisan organization. So we can't actually take sides. What we can do is highlight the issues and the considerations for people and highlight both candidates, but we have to be quite nonpartisan and be very clear about that. If you stray from that, you get into serious trouble. And so we actually do spend some time helping individuals understand how to talk about the issues. Use healthcare as an example. How to talk about the healthcare issues, the concerns we would have about one side and the other side, and so we work quite diligently to avoid seeming partisan. And part the reality is there are people on both sides of the aisle, as we would call it, that are affected by MS and are very passionate about how MS affects people. But then they can also disagree on underlying sort of political approaches to the solution. There are ways for nonprofit organizations to be more politically active in the United States. There are other types of organizations that some charities have that are actually what we call political action committees that are established specifically for the purpose of lobbying and advocating, say perhaps with one party versus another. We as an organization have chosen not to take that path historically, and has it's worked for us up to this point. Of course, the future could bring different changes. We're always looking
It'll
and
all change.
evaluating. But what we find is that often, medical issues, healthcare issues, especially when it comes to medical research and providing needed services for people, are oftentimes not the source of conflict. It's more the how and how much it costs and what are some of the expectations that often are the places where you get the most vigorous debate.
Okay. We want to talk about the difficult stuff. So let's talk about the what's coming ahead. What do you see, Elizabeth, as the thing in 2025 that you foresee as something that you're concerned about? And you're muted, just so you know.
Thank you for that. So my concern will be really to be able to set the appropriate agenda with the policy decision makers, but also to bring the communities on board to make sure that the National MS Society, the people with MS are fighting alongside with us. So despite everything that is going on, that we keep our focus on the advocacy work that we're doing. That's very important. And that will be very challenging to keep that motivation going on. I think the new year is going to be exciting and scary at the same time because there are a lot of things happening for MS at the moment in the research, and a lot of opportunities that are coming up alongside. So really building the capacity to the individual MS patients, but also for the MS society to be part of these changes and these initiatives is important. But it's also for us on the practical side to see how can we do that? How can we financially encourage the National MS Society to dedicate resources for that, and for the patient also to keep the focus on the advocacy is a little bit challenging. But I see that with the new developments, with what's going on with the digital health, there are very exciting initiatives and projects that are there in the pipeline. So I would really encourage the people in the National MS Society to keep an eye on this and try to get involved and find ways, support to get involved in a very meaningful way in the future.
Okay, thank you. And Tim, what do you see for people living with MS in 2024 as being a hurdle to get over?
Yeah. So I think one of the hurdles I'm watching for is ensuring that they're able to get access to the new treatments as they're being developed, particularly for progressive forms of the disease. I think I was very excited by what was shared at ECTRIMS with the new drug, the tolobrutinib, which showed great promise for people with secondary progressive MS. So very excited that that's coming. And then what concerns me is that the agencies will say, well, it's somewhat effective, and so, let's not, necessarily approve it because it's not as effective as some of these other treatments. And I think one of the aspects of the conversation is to just remind people that, a treatment that's, say, 30 or 40% effective when you have secondary progressive MS is 30 or 40% more effective than we have now, which is nothing. And so we have to start somewhere, and that, beta-seron, when it was first introduced in 1993, was 30% effective against relapsing MS, and look at the world we have today. So we must start somewhere, and I do worry that there's a bit of a lulling of like, well, we have all these treatments and there are so many options. We just need to hold out for something better. And if we hold out for something better, that means people with secondary progressive MS don't have anything today, and we should not accept that.
And closer to home, Ava, where do you see the tough spots in 2024?
Okay, so from an organization perspective, I think the change of government is obviously one. Number two, we also have the Health Service Executive, which is what I mentioned earlier, provides MS Ireland, for example, with about 60% of its funding. They are restructuring and they don't know what that's going to look like. So I suppose from our perspective, it's hard for us to understand how we are going to be able to deliver services within those new structures. So that's from an organization perspective. I think from a person with MS perspective, we've talked about the lengthy waiting lists, the neurology services, but the other big one I think that really is always identified is housing. Housing is a massive issue for people with MS, and it is really, it's like if you were talking to one of the team of community workers, they would say that is a really big difficulty for people. And I always use examples because, again, recently we have people that come to our respite facility who are literally, with no exaggeration for effect, couch surfing between family and friends because they're on a waiting list for a house. And they're talking about they've no, obviously if you're couch surfing with family and friends, there isn't an accessible toilet, there isn't, all of these things. It's just wholly inappropriate. And the other big thing for us, which is totally new and something we have to look at in 2025, is young people being diagnosed with MS. And children's services are seriously struggling and under-resourced as it is. And we're trying to just engage now around, okay, where do we fit in here? Because obviously it's a completely different providing service to a child versus somebody over 18. But it's really becoming something that our community workers are having to deal with around the country. And we clearly know that children's services are not going to meet that need. So that's something that is really a focus for us as well, as something that's becoming quite significant.
Okay. Tim, we've got a question coming in. The drug for secondary progressive MS, what was the name of that?
It's tolobrutinib, so tolebrutinib, tolobrutinib.
And that's the generic name. Is
That's the
there
generic
a branded
name of it.
name yet?
Pardon?
Is there a branded name for that?
There's not a branded name because it's not been approved yet. So the
Okay.
company, my understanding is the company will be submitting it for approval with the US FDA later this year, and then I think EMA will probably follow soon. They might do both at the same time. So that's a really important development for people with secondary progressive MS.
Yeah, that's huge. As always, and especially tonight, I think our time is just flying along. We've covered a great deal. You've answered some great questions. I want to give each of you a moment, and because of some of the things that have come in, maybe I'll ask you if you'll focus your final thoughts on what we as people with MS can do relative to your particular organizations in Ireland, in Europe, and then in the US, and broader for our visitors and viewers who aren't there. So we've talked about the good, the bad, the ugly, the unspeakable. So don't be shy. But Elizabeth, we'll start with you. What one thing can people with MS do to help support EMSP and your mission?
I would encourage the people with MS really to look at what are the opportunities there, to get active, to become advocates at national level, at local level, just to raise their concerns and needs. If they don't voice it, we will never know what are the needs. So it's important that we hear from them, that the policy decision maker hear from them. So that would be the most important thing. Join the campaign, join your National MS Society's efforts in that direction, so that we can really be stronger on when we are representing the individual people with MS, just to make and influence positively the changes.
Okay, very good. Tim, in the US, what can someone do there to make 2025 better?
I know you only want one thing. I'm going to give you two things. One is get connected with the National MS Society. If you're interested in being an activist, the link that you have will help people become an activist through our activist network. There are other ways to get connected and engage with the National MS Society in the US. But then the second thing I would say is community is one of the most important things that people can do to thrive and be powerful with MS. So find a community, connect to a community, and find whatever works for you. Well, there's no one thing that needs to be, but find what works for you, because community is powerful in enabling people to live strongly.
All right, thank you. And as our host organization, Ava, I'll give you the final word on that. What do you need from us?
To be fair, I would agree with Tim and Elizabeth. So for me, the first is make your voice heard. Absolutely continue to advocate at a local level, nationally through MS Ireland, but also connect like the services are there and available for you. So it's about connecting with the organization as well. I think that's incredibly important, but that community piece is vital. We have like 30 voluntary branches around the country where you have people with MS meeting locally, whether it's for your support group or your coffee morning or whichever. That is incredibly powerful. Do you know what I mean? And I think that's important, because I think once people do that and that grows and develops, that helps people get support, but it also encourages fundraising activities and fundraising initiatives. It encourages people to go on their local radio and talk about their story. So it's a win-win, I think, for everybody. So it's stay involved, get involved, and I suppose try and help us all deliver on our vision and our mission. That's really what I would be saying.
Very good. As always, our time has quickly come to an end. You've answered some really important questions. I know there are so many more to ask. This really has been a unique opportunity for our viewers to ask questions of the international leaders for our cause. In fact, I don't know that this has ever happened before. So I thank all three of you for taking our call, taking our email, and being willing to do this with us. Who knows? We might have to do it again. So I suspect you'll be putting me on the spam filter on my emails. Until then, however, I want to extend my greatest thanks, appreciation, and respect to Tim Coetzee, to Elizabeth Kasilingam, and to our own Ava Battles, as well as my personal thanks to all of you for joining us over this year. To everyone, Galer, and that's it for this season of the Unspeakable Bits. We thank you for our audience for coming along with us on this new experience. And thanks to MS Ireland, I can say that we'll be back for another season next year. We're going to be starting in February of the new year with a whole new course of programs for you. So until then, keep an eye on our social media and our website, etc., and you'll see when that program will be and what the topic is. Until then, I'm your host, Trevis Gleason, wishing you and your family the best of health. And cheers, and back to you, Fergal.
So just to let everyone know, this is recorded, so anybody that I know, there's lots of people that didn't get a chance to see it that will want to see it. So it'll go up on our MS Ireland YouTube channel tomorrow. So anybody will be able to see it from there, and also to keep an eye out on our social media channels for when we'll be giving up we'll put up the registration for the next one coming out over the next week or so in February. And just lastly, I just want to say a special thanks to everybody, Ava, Elizabeth, Timothy, and Trevis, and everybody that has been tuning into this over the last year. And actually also just to say that as well as this one on our YouTube channel, all the episodes throughout the year and last year are up on our YouTube channel on a playlist. So I'd recommend people to go to that. So again, thank you so much, everybody, for giving us your time this evening. Take care.
Cheers.
Thank you. Take care.